Okay, hello everyone. Good morning or afternoon or evening, depending on where you all are located. My name is Ellen Hostetler. I'm the Chief Science Officer for the John Ritter Foundation, and we're glad to have you with us today. It looks like people are kind of joining us bit by bit, but this will be recorded. So for folks who missed the first half of it, or if you want to share it with other members of your children's care team or other loved ones, then you'll be able to access that, should be today or tomorrow on our website and on the YouTube page. And just to briefly introduce today's speaker, who we're really excited to have, we have Dr. Kate Cutitta today with us, and she came highly recommended by one of the pediatric cardiologists we work with a lot, who specializes in children with severe genetic aortic disease. So Dr. Cutitta is a assistant professor at the Texas Children's Hospital in Baylor College of Medicine, and she is a pediatric psychologist who specializes in the treatment of cardiac-related mental health concerns, including adjustment to disease, device and or surgery, and cardiac-specific anxiety or depression. So that is something that this group unfortunately knows all too much about, and we've had a lot of questions about mental health concerns in children with this condition from the community. And the SMDS community is very important to the John Ritter Foundation. So we wanted to fill that need that's been requested, and luckily found an expert here to share with us today. So I'm gonna go ahead and be quiet and let her give her expertise, and hopefully we can all learn something today.
Thank you, Ellen. Thank you all for having me today. So good morning, good afternoon, good evening, wherever you all are located. I'm just going to take a moment to share my screen and get everything set up here. Bear with me. And Ellen, can you confirm that you've got the right view?
Yep, looks perfect.
Wonderful. So today I'm going to give a talk called Out of Your Mind, because I'm a psychologist and my assumption is that everybody is crazy, right? No, not at all. That's not my assumption at all. I want to give the talk out of your mind and into your life, because there's so much going on with managing SMDS, being a caregiver, parent, or even a patient living with SMDS. As part of my job here at Baylor College of Medicine and at Texas Children's Hospital, I meet with patients and families aged 5 years old all the way up to our adult congenital heart disease program. So I work with a pretty wide range of individuals, because the research tells us that living with a chronic health condition and parenting a child with a chronic health condition certainly comes with challenges. This is no different for aortic disease or SMDS. And so today I want to give you a sampling of the research and the ways you can support your children and for yourself with managing SMDS and the constellation of symptoms that comes along with it. So, well, let's get ready to get out of your mind and into your life. I want to give you a little bit of a game plan. I really view my job and my role as being a coach. Parents and patients are the experts in their life, and I'm here to help along with providing game plans to get to the best outcome or best quality of life. So I'll start off with talking a little bit about SMDS and psychology and what the research might say there. Talk a little bit about chronic illness and distress in general in pediatric populations and other similar populations where I think we can draw a little bit of a parallel. And then how to coach that survivor to thriver mentality, really shifting the mindset of what's going on in your day-to-day life. And then coming up with a more in-depth game plan. So talking through strategies and ways that we can really enrich the life. So this is going to be a bit of a tapas kind of presentation, and hopefully get to some application at the end, and then leave plenty of room for discussion and questions as we go along. All right, so SMDS and psychology. When Ellen first approached me to give a talk to you all today, my first thought was, well, let's make sure we're up to date on the research, on the literature. Let me dive in and do a good old literature search because I'm a scientist practitioner. I practice both science and clinical work, and I want to make sure I'm giving you all accurate data. Well, I did that. So I typed in MSDMS and psychology, and I got probably 2 hits that could be kind of relevant. Really just saying psychological evaluation should happen, and there's a psychological burden associated with this diagnosis. Well, I don't think I would shock anybody here today if I shared those 2 facts and then closed out my talk. The rest of the research that pulled up with that search really didn't seem too applicable. There's no research, which has got to be incredibly frustrating being a patient or a caregiver living with this diagnosis. So when I think about the constellation of symptoms that is involved in an MDS diagnosis, you're fighting multiple battles at once. You all are pioneers. And I recognize that being a pioneer is not always a comfortable place to be. So hopefully we can find a little bit more comfort today. So let's talk about adjustment to chronic illness in general and see where we might have some overlap that could help. First off, what even is a chronic illness? So a chronic illness is a health problem that lasts longer than 3 months, and it typically affects activities, requires frequent hospitalizations, home health care, or extensive medical care of some kind. And about 1 out of 4 children in the United States, age 17 and younger, have a chronic health condition. That's about 15 to 18 million children. Chronic illness can present in different phases to children and family. Stress can range from acute stress, like at the diagnosis stage, just figuring this out, followed by long-term or chronic stress. This can also be a cycle where we start off with a diagnosis and the acute stress of having a diagnosis, move into more of the management phase with that chronic stress feel, and then have hospitalizations or acute health events such as stroke, dissection, and other challenges that come along that rotate you through that cycle of acute stress and chronic stress. That's a lot. That's a lot on a caregiver. That's a lot on a child. So how do we work on adjustment? If we know that adjustment to chronic illness can cause so many challenges, what even makes up adjustment? So personality and temperament. And I think all of the information that I share today is the same, whether this is a child adjusting to a chronic medical condition, an adult adjusting to a medical condition. Our personality and our temperament really determines how we respond to a situation. Developmental stage, where learning is taking place for this child, how learning is happening, what the diagnosis even is, how severe the diagnosis is, and then the social support that comes along or is present for management of the diagnosis. I want to jump back to personality and temperament because there are differences in your children, and you probably parent your children differently depending on their temperament. And so the same thing goes for adjustment to chronic medical condition. One child may have a difficult time with needles, another may be incredibly brave. And so really being the expert caregiver and figuring out the best way to attack challenges that come along for each child or each family member is important. Children's understanding of their illness and the coping strategies or the tools that they have in their toolbox also change as children grow older. There might be a stage in a child's life where they're really relying on their parent or caregiver to prompt them, to engage in a coping skill or coping strategy. And then as they get older, they might be able to call on that skill more independently. All of these things really add and load on to adjustment. What about for parents and caregivers? Parents of children with chronic illness have decreased psychological and physical quality of life relative to parents of children without chronic illness. Think about that. The parent and the caregiver that's responsible for the adjustment of the child is already experiencing lower psychological and physical quality of life. We're already starting behind. So, figuring out how to harness positive or adaptive coping strategies could be helpful, because the research tells us that when individuals have positive or adaptive coping strategies, that is really linked to more positive psychological and quality of life outcomes among caregivers of children with chronic illness. There's also a link between the extent of the complexity of the caregiver role and quality of life too. And when thinking about SMDS, the challenges and the caregiving responsibilities that potentially could come from that, I think it's really important to acknowledge there's a lot here. There's a lot to deal with. And so coping is key, and it's a lot easier said than done. And I'll hope to get into a few coping strategies as we go along today. Because my background is in cardiac psychology and really focusing on acquired and congenital heart disease, and in particular on patients that have heart failure or arrhythmias and are at risk for sudden cardiac death, I want to share a little bit of that research too. About a quarter of all heart patients report psychological distress. That's pretty big, and more than the general population. And with arrhythmia patients, so patients who are at risk for lethal arrhythmias, there is a great amount of distress. You can see in the chart on the left that inching towards almost half, up to half of patients with arrhythmia report depression. About 20% report some form of PTSD or trauma reaction. And anywhere from 13 to 38% report some form of anxiety, generalized anxiety. Rates of depression and chronic illness really vary depending on what subgroup we're talking about. And so there's research that probably needs to be done to help determine where our baseline is for SMDS. I draw this parallel between the arrhythmia patient population and SMDS because of the risk for acute events, like having an arrhythmia that needs medical attention immediately. While it's a different population and a different diagnosis, there's still that acute presentation, that acute stressor that I referred to earlier, with a potentially long-lasting adverse impact on things like physical activity, patient-reported quality of life, and anxiety. Again, in this population with arrhythmias and having devices that help terminate or stop those arrhythmias, we know that younger patients are at greater risk of poor psychological outcomes. Patients over the age of 13 report higher levels of anxiety compared to the reference group of other children with a chronic medical condition. And nearly 85% of children avoid activities, things, or places after diagnosis and management of a pediatric arrhythmia. And I just stopped to think, 85% of kids avoid activities, things, or places. Imagine the impact on someone's quality of life if they're avoiding things that they once enjoyed. Now, quality of life, I've been throwing that word around a lot, and I'm sure you've heard it come up in talks or maybe in your own research that you've done. And I want to get a little bit into what makes up quality of life and what quality of life outcomes look like. So the data looking at individuals with enlarged aorta, these are adult individuals because again, we don't have a literature basis here. So we want to draw some parallels to be able to say this might be going on. So adult patients with enlarged aorta report lower health-related quality of life compared to the general population. Female patients, younger patients, and partners and caregivers of patients with enlarged aortas also report lower quality of life. You might see a common trend between this population, the arrhythmia population, that females, individuals of younger age, and parents and caregivers and partners all experience a decrease in quality of life and psychological outcomes while managing a chronic medical condition. Also noting that individuals with previous aortic surgery of any kind also impacts quality of life. And those individuals have report a lower quality of life despite having maybe a repair. So when we think about the mental burden that a diagnosis, surgery, care plays on the parent, caregiver, and child, it's big. Looking at psychological distress and what has the potential to load onto psychological distress, there are a couple of factors, particularly in the aortic disease literature. Coping skills. How well can we manage what's being thrown at us? What tools do we have in our toolbox? Family and team communication, disease knowledge. What do I know about my disease today and what do I know about my disease for down the road? Social and professional life, how those things are impacted. And then also playing a role in psychological distress, aortic diameter size, financial impact, symptoms, and limitations. Now, a couple of these things like aortic diameter and financial impact may largely be caregiver and parent worries and distress. But they're important to pay attention to because your family is a system. Kiddos aren't going through diagnosis and medical management independently. You're a team. And so when one member of the team is injured or down, the whole team feels that impact. Interesting information about financial stress, that those who report financial stress with managing a chronic medical condition such as aortic disease report 3.5 times more anxiety than those who are not impacted by financial stress. That's a big number. Physical limitations are also another thing that go into disease knowledge. Maybe how you cope with physical limitations is important, and how physical limitations may impact both social and professional life. And mental health is health. Severe physical or emotional stress increases blood pressure and can increase the risk for acute events. This is the difference between stress and strain. Our bodies react to our minds, and how we manage stress impacts our health. How we cope mentally impacts our health. So, what are some types of coping that we can look at that the data shows is helpful coping? There's two primary forms of helpful coping: primary control and secondary control coping. Primary control coping is more problem focused. Efforts to change a stressor, like problem solving, or change one's own emotional reactions to a stressor, like changing emotional expression. Changing emotional expression is probably pretty challenging. Problem solving probably works in certain situations, but not in every situation. Secondary control or emotion-focused coping supports efforts to adapt oneself to a stressor, using strategies such as changing our thinking, engaging in positive thinking, acceptance thinking, and distraction coping to get through things in the moment. Secondary control or emotion-focused thinking might be most helpful with a new diagnosis or acute health problem, because there's not much problem solving to do with those things. We really have to focus on how the individual is responding and adapting oneself. How well a coping strategy works depends on the stressor, just like I mentioned. Secondary control coping is related to better adjustment in children and adolescents. So we really want to push more emotion-focused coping for children of that age, because a lot is out of their control. There's also one other type of coping that I'm not mentioning. It's more of a negative kind of coping, the use of disengagement coping. It includes cognitive or behavioral avoidance. I don't want to think about this diagnosis. I don't want to take my medicine because it reminds me that I'm sick. In general, disengagement coping is related to poor adjustment. Avoidance is not healthy. And that's something to pay attention to. So we talked about what's going on in the literature with chronic illness, maybe what some positive or more adaptive coping strategies might sound like in literature, but what do they look like? And why are they important? Well, they're important because they really change the game. They change the game from being a survivor to a thriver. I'm sure you all have seen or heard of the show Survivor, where the goal is to outwit, outplay, outlast. Well, that's great. That's important, especially when managing a chronic medical condition. You're already outwitting. You're part of this group and educating yourself, participating. You're outplaying. You're actively taking charge of you or your child's health. And you're outlasting. You're here. You're listening. You're present. Something tells me that you're not just here for you or your child to survive. You're here for them to survive and thrive. Some days are focused more on surviving, and others are focused on thriving. And we really want to shift to increase the symptoms of life, because there are so many other symptoms that you're managing and juggling every day. After all, you are a pioneer that I reminded you of in the beginning, looking to expand knowledge and improve the quality of life for your family, your kiddo, and other families to come. So let's take a little bit of a dive into how that can happen. And I'll give a little bit of an introduction into what I do. I practice what's called cognitive behavioral therapy. It's backed by science and one of the most commonly used forms of therapy for adjustment to medical conditions, as well as management of anxiety and depression. And cognitive behavioral therapy really relies on three components: our thoughts, our behaviors, and our emotions, and how they're each tied to each other. You'll see there are double-sided arrows on each part of this cycle, indicating that what we think affects how we feel and act, what we feel affects how we think and act, and what we do affects how we think and feel. Now, looking at this, we want to figure out, where can we change? Where can we intervene to help pull more good stuff out of life, to improve quality of life, to decrease stress? I'm looking at emotions and the left side of the screen there. Changing your emotion, that sounds pretty hard. Like, if I'm sad one day, I should just be happy, and that will help. So we don't intervene on that part a whole lot, but thinking about how we can change our thoughts and our thought processes and our behaviors, what we do on a daily basis, that then both of those components might have an impact on how we're feeling and our emotions. There is a particular form of CBT called ACT, or Acceptance and Commitment Therapy, where the focus is to accept your reactions, notice them, and be present. Choose a valued direction, like thriving, living life, being a cohesive family unit, and taking action or taking steps in that direction. ACT is a really great form of therapy and intervention for individuals working on adjusting to a chronic medical condition. And I'll bring that up a little bit towards the end as well. And the last part of this ACT is taking action and kind of just doing it, getting into life, even though being a pioneer doesn't always feel comfortable. Doing the things that make your family, doing the things that make your kiddo, and finding that richness, that good stuff in life. This next slide is a video, so hopefully it'll work for me. It's a famous, I think, influencer, Elise Myers, that's on Instagram and TikTok, and speaks a lot about mental health and experiences growing up that involved a lot of challenges. Now, does not have a chronic medical condition that I'm aware of, but I saw this clip and I think it could be really applicable, and it stuck with me for a while. So I'm going to play it for you and see what happens here.
Nike, I need you to listen. Listen. I have a new campaign idea for you, and I think it should just be all across the board everywhere. Just do it scared. Just do it anxious. Just do it tired. Just do it overwhelmed. For people that are just normal people that get really overwhelmed with like normal life, brushing your teeth, putting clothes on, sending an email, making a phone call, actually going to the coffee date that you scheduled. And then you can cut back and forth between like athletes that are like really nervous before a game, or really nervous before like a press conference or something that they have to do fancy athlete style, just like, and then cut to a person going at their desk, sending an email. Because I like wearing Nike. It's like pretty much all I wear on my feet, but I am not an athlete. And I have to just do it scared, but normal person things. That would be incredible. And I need you to do this.
So I think that that's a really helpful illustration of sometimes we do things that are really hard, and we figure out how to do them to help make our life the life we want to lead, the life we want to live, the life we want to model for children and for our loved ones. This doesn't mean going against medical recommendations from your team regarding activity or activity limitations. This means don't wait to feel comfortable to live life and do the things that you want to do. You're not your fear, and your child is not their disease, or you are not your disease. So how do we develop a game plan to thrive? We talked about ways that we could change our thinking and our behavior to make that shift from survivor to thriver. Now we have to figure out how to work on that thriving piece. The first step is to figure out what's even going on. What's our baseline? What's happening on a day-to-day level? So in order to thrive, we have to identify challenges and engage in some kind of coping to help with those things. So when I meet with parents and families, I like to suggest that you be an observer for your child or your loved one. Observe activities, how eating is going, how sleeping is going. Are kids waking up in the middle of the night saying they can't sleep or they can't fall asleep because they're having worries? How's their mood? This one can be a bit tricky for teenagers because they might be baseline irritable. But if you're noticing mood changes over time, that's something to key into. What's happening socially for your children? Are they engaged in their peer groups and the things that they enjoy doing, or are they disengaged? And how is engagement in medical care going? Did it change? Did medication taking suddenly get harder? Did going to doctor's appointments or even just getting in the car for a doctor's appointment just change? Those are all things to pay attention to. When families come to me, they think that I'm the expert. And while I did go to school for a really long time to do what I'm doing, I typically respond by saying you're the expert in your child's behavior. Psychologists don't have blood tests the same way that my medical colleagues and counterparts do for mental health issues. We rely on observational data. We rely on parent report to help understand your child because you're the expert in your child. So these things are all really important things to observe as a parent or caregiver. Now, the playbook to get to this point of thriving. We have to pay attention to a couple of things like communication, how sleep is going, stress management, and making sure we're getting out of our mind and into our life or re-engaging in life. The first two might involve some of that primary control coping that we talked about, where we problem solve, how to talk to our doctors, whether we're MyChart messaging or using some kind of app to message our providers. How do we get in touch with people? Sleep. Sleep might also take a more problem-solving approach. What strategies do we do to help make sleep go better? And I'll talk a little bit about that in a minute too. But the second two, stress management and re-engaging in life, these two really involve fostering that secondary coping strategy by learning stress management techniques, distraction, positive thinking, changing our thinking or about a scenario, and accepting a diagnosis, accepting a way of new normal. I think you all already have one of the biggest plays to be able to get back into life and to manage life and have more symptoms of life. It's the Ritter rules. You're doing all that you can do to manage health and live the quality of life that you and your family deserve and long. So you have these rules, you have a game plan, right? Thinking about when we're in a public building, like at work or in school, we practice fire drills so that people know how to exit the building in the case of an emergency. We hope to not use it. We hope to have that on the back burner, but it's there. It's there in case of an emergency. And I think the Ritter rules are a great safety net and part of healthcare that are there. They're there when you need to reference them and live by. So communication. So we can talk about communication with your medical team. That could probably be a whole different talk. But communication with your children or your loved ones can be challenging, especially if one or both of you or the whole family unit is experiencing some form of stress that's making day-to-day management or medical management hard. So thinking about language that's used with your child, explaining the diagnosis in a developmentally way, using simple explanations, small words, and repeating statements. I think the last two under language are the most important, repeating statements and being truthful. When we think about the best ways to get kiddos to over time learn the information that we need them to learn for their own safety and wellness, being consistent is the most important piece. So being a broken record in a sense when explaining what's going on with their health. And most importantly, being truthful. Trust is a really important part of being a player in your medical care, and particularly for children. They've already given up a lot of control. They're being driven to the appointment, oftentimes being poked and prodded, and things are happening to them. And so we want to make sure that the parent caregiver role is one that remains truthful and honest at a developmentally appropriate level. Which brings us to the next piece, looking for storybooks, pictures of the hospital that you might go to or medical center, particularly if you're changing medical centers or going to a new place, maybe even pictures of your doctor. That could probably be particularly helpful these days, given that we're all going around wearing our masks and half of our face is covered up. So maybe knowing what the doctor might look like before you go for a medical appointment, if they haven't met them before mask wearing time. And then lastly, giving your child a role to play. What are some, if you're going to the hospital or even going for a doctor's appointment, what are some favorite items that the child can pack? What's a favorite stuffed animal or game to pass the time? What are we going to eat afterwards? Whether it's catching food on the way home or going home and eating lunch together. What's the rest of our day look like? Maybe there's something special that happens at the end of the day to end the day on a high note. Adjustment reactions are normal. I share that with the medical teams I work with all of the time. It can be really distressing to see our child in distress, to see anybody in distress. But having an adjustment to a change in health status or an acute health event is normal. Emotions happen, and sometimes we don't have as much control over them as we want. But as caregivers, as parents, you have the ability to model positive coping strategies. Some of the strategies that we talked about, and we'll talk about a little bit more here. Children learn so much by their environment and by the people that they look up to. So if you notice, hey, I'm having a hard day, maybe engaging in something that's relaxing or helpful with stress management, and even making the point to say out loud what you're doing and why you're doing it. Kids will pick up over time what you're doing. Sleep. I talk about sleep with every single patient and family that I meet with. They come to me thinking we're going to talk about heart disease, heart failure management, and I do talk about those things too. But I talk about sleep for a long time. Sleep is a basic building block of quality of life, just like any other part of basic self-care. Sleep helps manage cognitions, emotion, and ultimately quality of life. Sleep impacts how we emote during the day and what kinds of emotions we show. If we're really tired, we're probably going to be a little bit cranky. Emotions impact how sleep goes. If we're really anxious, it's going to be hard to fall asleep. So sleep is really important. Also, during normal sleep, your blood pressure goes down. which means that if we're having a child or even an adult with sleep challenges, your blood pressure is staying higher for a longer period of time. Higher blood pressure is one of the leading risks for heart disease and stroke. So sleep is health. So there are a couple of tips that, that I always bring up about sleep and working on sleep hygiene. They are, try to keep the same sleep and wake time. Try to keep a regular routine going. Now that routine might look different given that it's summer time and we don't have to wake up as early, but trying to keep a regular sleep and wake routine will help us know when it's time for bed. Avoid naps when you can. Try to keep naps to 20 or 30 minutes. Have some relax and wind down time at night. Limit screens. Screens are one of the biggest barriers to good sleep quality. You all may have heard of melatonin, a hormone that our body naturally creates to help us go to sleep and helps with sleep onset or the start of sleep. Well, blue light, or the light that comes from all of these screens that we carry around with us every day, that blue light makes melatonin not be produced in our bodies. So when we don't have that melatonin happen, it makes it harder to fall asleep because we're not getting that signal from our body to go ahead and be drowsy and relax. So screens, it's really hard to put them up, even for many of the adult patients and colleagues that I work with. It's something to work on though, taking a bit of a relax and wind down time with no screens right before bed. Stress management, one of the biggest ones. Stress management components include coping skills, how medication goes, how medical appointments go, disease education. Coping skills I already referred to a little bit. Medication management, if that's something that happens every day, it means it's impacting you every day in some way, shape, or form. Most of us underrate our ability to cope and overrate the impact of our problems. I'm going to say that again because it's something that is easy to forget. Most of us underrate our ability to cope and overrate the impact of our problems. We don't have a lot of confidence in our ability to cope, and we really do have the skills, we just have to use them. Stress is an unavoidable aspect of life, and it can be positive or negative. Our bodies react to stress by releasing hormones into the bloodstream. These hormones have an impact on our heart rate and how our blood vessels tighten and relax. When our blood vessels are tight, our blood pressure temporarily goes up. If stressors become more chronic in nature, happening every day, our body spends more time in high gear, meaning that there's higher blood pressure. So stress management is health. And re-engaging in life is the last part of having a good game plan here. Activity restrictions can admittedly make this challenging, but thinking about how you can add pleasant activities into day-to-day life, make small goals to engage in new things that make your child happy and your family happy, and have more symptoms of life. Really important. A psychologist, Martin Seligman, once said, happiness is a choice and optimism is learned. Gratitude is one of the best ways to learn that optimism. There's a lot of research behind that idea of practicing gratitude and sitting back and reflecting on your day and thinking about at least 1 to 3 things that you're grateful for in that day. They can be small things, like for parents or caregivers having less traffic on the way to work. For kiddos, they can be grateful for some screen time that they have, for some Roblox time. Whatever the case may be, there's research behind gratitude. It sounds fluffy, but we have the data to back it up. So other ways you can incorporate strategies to help with re-engaging in life, building a daily schedule, Children and adults, we thrive on routine. We thrive on having a schedule. We do best in those kinds of situations. Incorporating projects and activities that are enjoyable. Parents and caregivers can model that positive coping strategies that we talked about. Engage in social support. Pull the people in around you that help you and make you feel good. For kiddos to pull their friends in too. And medication adherence, making sure that the thing that happens every day to take care of health happens first, is most important, and has a good routine around it. I want to talk a little bit about finding treatment. So a lot of the things I discussed today, you might have some ideas about how you can plug those into your daily life. And that's great. I encourage you to do that. And then there may be a time, either soon or down the road, where finding professional help might be something that you're interested in. And so I always recommend that people contact their insurance company or their cardiologist or neurologist or their primary care physician or pediatrician to see if there are any local folks that they would refer to for a psychologist or a therapist. In general, if you're wanting something aside from more supportive counseling, I would recommend looking to providers who can engage people in cognitive behavioral therapy, or CBT. It's usually brief, targeted intervention focused on mood symptoms, adjustment to medical condition, anxiety or depression, and there can be a family component. So for instance, I meet with parents and caregivers for part of my sessions. I help families and caregivers develop skills to go home to help their children during the week. Therapy isn't magical. There's a lot of homework that comes with it. And parents, again, are the experts and have the ability to implement the strategies talked about in therapy. So the last thing is to ask for a provider with experience with pediatric or health-related conditions. I think that's really important because many of the challenges you all are experiencing or may experience in the future are unique challenges that people with a medical training and medical background and understanding how chronic illness goes may be the best fit. You're pioneers setting examples for the families to come, and you're contributing to research and the understanding of what's going on with SMDS and paying it forward for other families to come. And I think this group is sounds like such an amazing group. And I'm happy to see if there are any questions or comments that I can address. And I'm going to go ahead and end here.
Thank you so much for that. I feel like I learned so much coming from the genetics background of things. This is not something that we think about day to day. So I feel so much better educated. And I think that a lot of these things apply to probably the broader community of patients with similar disorders who we also serve. So personally, I'm glad to know that I can use this to help the wider community that we serve as well. I did have about 8 questions emailed to me ahead of time by people who couldn't make it, but if anyone who's here wants to ask a question, we can start with them, but maybe I'll just say one to kick us off, which I loved how you talked about some of the connections between physical body and mind. And one of the questions someone asked was about distinguishing between symptoms of anxiety, say having a pounding heart, versus cardiac symptoms that might be concerning, given the risks with this disorder. And that's something that hadn't occurred to me ahead of time, but I think is something probably people struggle with. And I've heard from people, I went to the hospital and they said I was having an anxiety attack or a panic attack, versus every pinch or pain, it also could be something serious. So obviously you can't solve that problem, but I wonder if you just had any comments about that.
Absolutely. And I want to just say for the general population, like you said, has a really difficult time pinpointing what's anxiety and what's cardiac related. So then we throw a diagnosis where we're told, hey, monitor these things in your body. And then all of a sudden we've heightened that experience, right? Every little thing brings a question to our mind that may not have happened before. So it is a challenge. It's a very real challenge. And I think the way that I tend to approach this is if you're having that thinking and wondering about that, I think building in some coping skills and some relaxation so that we can lower your overall stress and anxiety, and then have a more clear picture of what's going on physically. Because what I'm hearing in that question is, if there's so much anxiety overlay, you're never going to be able to disentangle unless we go to the emergency room every time.
Right.
And that certainly doesn't make for a rich life, going to the emergency room every time, even when it's anxiety.
Absolutely.
And is really important to patient safety and well-being. So decreasing overall stress would be my first recommendation there, so that we can better tease apart those two things.
That makes a lot of sense. Yeah, going to the emergency room in general is no fun for anyone, much less if you have trauma tied to that or already anxiety tied to that experience. Someone else asked about, I don't know quite the proper term to categorize this, but basically catastrophizing. I don't know if that's actually a real word or not, but thinking, which is similar to what we talked about, but thinking, okay, I need to have surgery. I'm probably going to have a bad outcome. Maybe something bad will happen to me during surgery. Maybe I might die during surgery. Maybe my parents will never recover from it, or turning these, I don't want to call them small events because they're not. Sometimes they're large, but thinking that the worst is going to happen from that. And they mentioned that their child kind of gets in these loops, feedback loops, where it's everything that happens is going to be the worst possible outcome. And there's not really a question there, I guess, but just that that's, I don't know if that's like a termed phenomenon, worst case scenario in life, or intrusive thoughts, I guess, where you're not able to turn those ideas off. But I guess maybe that fits with you're saying reducing the general anxiety levels to start, you're at a better baseline.
Yes, I think similar thing. Catastrophizing is a word. It's a word we use a lot.
Great.
And it's one of the hallmark features of anxiety, right? Always jumping to that worst case scenario situation, which adds to anxiety. And so lowering the overall baseline level of arousal or level of anxiety is always a great place to start. And if catastrophizing is something that's happening every day throughout the day, even on non-medical appointment days, there's a difference when if we're going to the doctor, then we start to worry. Some part of that is normal, right? There might be something new happening. That's somewhat normal. But if it's happening every day and getting in the way of life, that might suggest, hey, how can we get some professional help on board to really harness this and figure it out?
Yeah. Well, it's probably helpful to hear that is a common thing for everyone as well, just baseline. Someone in the chat privately sent me a question about anger, which I find really interesting in their child. And is this a manifestation of, anxiety and depression? Is this just a different issue, being angry at they didn't specify, but being angry at restrictions placed on them, or that they have to go to the doctor all the time, or that why me? And is anger related to these issues that you've been talking about?
Anger and irritability is, again, one of the features of anxiety or depression. So without knowing a whole lot more, it's kind of hard to elaborate on that, but absolutely, that's something that you're paying attention to your child. You're being an observer of your child and noticing, hey, this is happening at times that are not okay. And so I think that is really important and smart. And so you've already done, whoever asked that question already did the first thing, and they've observed and they've noticed. And now that you've done that, you can figure out, okay, what's the next step? Do we need to get help, or do we need to, is sleep just so terrible right now that emotions are off? So the first step is that identification piece.
And I'm sure that, we all get angry sometimes about way things have happened, that some of that is probably not a bad thing for them to be able to express some of those feelings if it's an appropriate time, or is anger something that we should avoid all the time? I shouldn't speak, I'm not the expert here.
Anger has its place. It can be helpful, just like you said, expressing emotion. All of our emotions can be helpful. There's kind of a spectrum. And when we start to see anger interfering with our social lives, our family life, school, or medical appointments, that'd probably be a giveaway that something deeper is going on here. If it's anger that comes up every once in a while and is kind of quick to resolve, that might be something that's less of a problem to address.
Sure. And then the last one I have on my list is talking about the effect on other siblings in the family. So probably most of the families out there, there's multiple children, but only one typically, because this is a de novo or spontaneous disease. In most of the patients, there's usually only one affected child in the family. And I guess I wonder if you've seen this dynamic in the other families that you treat with similar disorders where, maybe the other children feel left out or forgotten, or maybe the child who's affected feels as though they are a burden on and harming the family unit and other kids. So if you just have any knowledge to impart, that would be helpful, I'm sure, to most of the families listening.
Sure, I think that can really go two ways. That left out piece that you mentioned, right? There's a lot of attention and special time that's getting spent, whether it's in the hospital, even though we all know it's not necessarily happy special time, but it is time with their caregiver. So there's that reaction. There may also be a kind of semi-caregiver pull for a sibling to step in and help out, or maybe be maybe kind of parentify themselves or turn themselves into a parent. I think one of the biggest things looking at the research is siblings, depending on age, of course, might look pretty similar to caregivers, especially if they've witnessed an acute medical event, like a stroke or something like that. They have a lot more memory sometimes than the patient may have of the medical event. And so paying attention to all members of your family unit and observing all members of your family unit is really important to family adjustment, because you're a team.
Yeah, that's fascinating. The parentification part of it I hadn't considered, but and certainly talking to adults with this condition, I know they're, for some of them who have spouses or partners, that is a huge, those folks are often feeling a lot of those issues in the same way that a parent does to a child, and feeling like they have to take care of them. So that's fascinating. Well, we're at the hour mark, so I am going to let you go because I know you are super busy, but I loved having you here and learning so much. I think the community is really going to benefit from this. So thank you so much, Dr. Cutitta, for joining us today and sharing your knowledge, your expert knowledge with our community. We all really appreciate it. As I mentioned at the start, we had multiple people email us about this issue. So I hope that this helps the folks out who were requesting these resources.
Yeah, thank you for having me.
Okay, and if you haven't watched the webinar that we did in, I want to say April, with Dr. Milowitz about research for SMDS, please go check that out as well. Both of these videos will be under the smooth muscle dysfunction syndrome heading on YouTube, so you can find them there, and we'll be doing another one in the fall. So thanks again, and we will see you all soon. Take care, everyone.